Order, and I want to first of all thank all of our witnesses, including our very distinguished witnesses from the administration. One, for your tremendous work that you're doing in this opioid crisis, and secondly, for taking the time out here to provide expert testimony. And we do have a second panel of experts who will follow. So this, I think, will be a very enlightening and hopefully motivating hearing on what do we do next, and of course, to go very deeply into the nature of the problem and how it has been exacerbated almost from month to month. It's getting worse, as we all know. Chinese-made fentanyl, a synthetic opioid, is killing Americans. More than 29,000 in 2017 alone. We must hold the Chinese government accountable. Kirsten Madison, Assistant Secretary of State for International Narcotics and Law Enforcement Affairs, will testify today that China is a, quote, primary source of illicit synthetic drugs coming to the United States. Paul Neeram, Deputy Chief of Operations at the Office of Global Enforcement for Drug Enforcement Administration, or DEA, stated in his testimony that China is one of the world's top producers of precursor chemicals used to manufacture fentanyl, as well as chemicals used to process heroin and cocaine. In our second panel, we'll hear from, again, some amazing experts. One is Ocean County, New Jersey prosecutor Joseph Coronado, who has called the China-made fentanyl influx into the United States a synthetic storm that is, quote, devastating. He will thankfully note that local law enforcement is doing something about it, like his program, the first in the state of New Jersey, to allow drug abusers who voluntarily turn themselves in at a police station, and thus far it's been over 800 since 2017, without being prosecuted. So that the idea of an engraved invitation, come, we will help you. He is obviously very tough on crime, but he also has a great humanitarian heart and is saying, we want to help, and treatment is a way of intervening for a positive outcome. And the program, based on statistics, has almost certainly reduced deaths. Still, Prosecutor Coronado will note that based on his medical examiner's toxicology analysis in 2014, 10% of overdose deaths in the county had fentanyl in their systems. Shockingly, in 2018, fentanyl-related deaths have jumped to over 80% or even more. He will tell the committee that synthetics will become the predominant type of illegal drugs abused within the next 5 years, and that in many instances is being sold right over the internet. I will ask both our distinguished witnesses from state and DEA what the United States is doing to hold China accountable for fentanyl in the United States. What kind of cooperation are we receiving? Are we using existing tools to hold bad actors in China accountable? We have tools such as the Global Magnitsky Act, which targets corrupt officials and human rights abusers. Is that under consideration when it comes to this crisis that is slaughtering so many Americans? Recently, the House passed bipartisan comprehensive legislation to address the opioid crisis, including the Synthetics and Overdose Prevention Act, now pending in the Senate. The bill requires the U.S. Postal Service, as private carriers like UPS and FedEx are currently required to do, to obtain advanced electronic data, or AED, detailed info on the shipper and the addressee and other data, empowering law enforcement, Customs and Border Protection, and others to target fentanyl and other illegal drug shipments. Bryce Pardo of the RAND Corporation will testify today, and this is of high significance, of course, that the potency of fentanyl has sharply increased the number of opioid overdoses, and that the drug overdose crisis, in his words, now surpasses major public health epidemics of prior generations, including the HIV/AIDS epidemic. As we all know, every single congressional district in America has felt the scourge of the opioid epidemic. Two fathers, Don Holman and Eric Bowman, who are both in the audience today, both lost their sons to opioid overdoses last year. Don lost his son, Garrett, to an overdose to synthetic fentanyl, and as he will show in a written statement submitted to this committee for the record, the package came straight from China. His son ordered it online, not knowing of the poisonous effects fentanyl has. His daughter Kristen testified before the House Judiciary Committee earlier this year and described how her loving brother fell into this trap. Eric's son had a similar ordeal in 2017 of September, losing his beloved son, Eric Chase. Last week, I spoke at a Mercer County International Overdose Awareness Day, sponsored by Mercer County Prosecutor Onofre and Robbinsville Mayor David Freed. Personal testimonies offered by survivors and recovering abusers were deeply moving. Trenton Police Chief Pedro Medino spoke of the loss of his son, Petey, and I've known Pedro for decades, loves his son, good guy, not just him, but his son, and yet he was overcome by this terrible, terrible opioid problem. In his comments, he talked about how he has relied on God to get him through this crisis and said, God can help all of you who are surviving, the family members and the friends. Advocate Mark Manny, who lost his son, Christopher, spoke of his opposition and made it very clear that his horrors of the addiction in losing his son, Christopher, and the pain that just doesn't go away is ever present, as he said. And then we heard from Adrienne Petta, who recounted the horrors of her addiction. She's one of the lucky ones who was able to get through it, and she herself is now a recovery specialist. One of the most moving parts of her testimony was, she said, I have 2 children, and this is after she was off. She thought she was clean. And then she said, if you were to put a pack in front of me, a bag, my 2 kids would take second, and the bag would come first. That's how strong, as you know so well from your good work, this terrible chemical does have. For the record, Monmouth County Prosecutor Christopher Grabicione's opioid diversion program steers certain low-income nonviolent offenders to treatment rather than traditional criminal prosecution. And again, Angelo Onofre from Mercer County is doing the same thing and announced that every municipality in Mercer County had agreed to sign up. And I think that is a very important step and a model for every municipality in this country to look at this as a disease. Go after those who are hawking it and selling it, put them behind bars, but for the victims to treat it for what it is, a disease. I'd like to yield to my good friend and colleague, Karen Bass, for any comments you might have.
Thank you.